that everyone can hear okay. So if you are having any trouble, you can always come in through the chat line and let us know if there's any technical difficulties. So, okay, we're going to go ahead and get started. Hi, everyone. My name is Melinda Mochizuki, and I'm the Training and Events Coordinator at the Center for Collaborative Governance at the University of Colorado, Denver. Thank you so much for joining us today. We're really excited to host this webinar series, Network Leadership from the Field, Linking the Research to Practice, as part of the Center's trainings to share skills, practices, and research with network practitioners. As you may know, more and more we're seeing evidence that people today are deeply involved in networks, but are really struggling to find the information and tools to build the knowledge and skills for this new way of connecting across boundaries. The trainings that the center offers provide a focus on building network leadership, which is a leadership framework where leaders and members of networks are guided to use data to make decisions on the process of building, managing, participating, and evaluating effective networks. Following today's presentation, our next webinar in the series on April 21st will be presented by Joe Mendica from Foothills United Way. Joe is the Vice President of Community Impact there and has been really pivotal in moving the organization towards a strategic vision for how United Way will fund community networks. Joe will add a really needed funder's perspective to how network leadership is used to develop collaborative initiatives, and specifically will present on high-impact community initiatives. The registration link for this will be shared in the email following this webinar. After that webinar, the center will take a break to host the 4th annual Network Leadership Training Academy, which occurs this year, May 16th to 18th in Denver. This is a really great 3-day interactive workshop that focuses on how to build, manage, and evaluate networks, and will also include some really pertinent topics with breakout sessions on facilitation skills, conflict training, and collective impact for network leadership. And information on the training and agenda are listed on the website that you can see here on the slide, and we'll also share that link in a follow-up email. Just a note that early registration for that ends April 4th, and after that, prices will increase. So it's really great if you're able to go ahead and register as soon as you're able to. And I just wanted to mention that following this webinar, the slides and any resources and the recordings will be made available on our website and will also be sent to you through email. So in a moment, I'll introduce today's speaker, but before I do, I just wanted to do a couple of logistical notices and draw your attention to the Q&A button at the bottom of your screen. And so throughout the presentation, please type your questions here in that box. And at the end of Danielle's presentation, I'll go ahead and facilitate a Q&A session. You can use the chat box for anything that's more technical related, any issues hearing or seeing things, and I'll be keeping an eye on both of those. So now I'd like to introduce today's speaker. Danielle Varda is an associate professor at the School of Public Affairs, University of Colorado, Denver, with a secondary appointment in the Colorado School of Public Health, Department of Health Systems Management and Policy. She's also the director of the Center on Collaborative Governance and the author of the Partner 2. Prior to her current position, Danielle was a researcher at the RAND Corporation. She specializes in collaborative governance and network leadership, focusing specifically in public health systems and services research. Her research focused on evaluating the network structure and interorganizational collaborations between the public, private, and nonprofit sectors, and the subsequent network effects of these recorded interactions. She has developed models and methods of network measurement, including developing questionnaires and analysis of diverse network data. Specifically with the funding from the Robert Wood Johnson Foundation, she developed a social network analysis tool known as Partner to administer surveys and to link an analysis tool. This tool is primarily used in the practice community to measure and monitor collaborative activity over time, and Partner has been used in over 600 communities. Danielle and the Partner team in the Center on Collaborative Governance work closely with communities across the country to evaluate their community networks and work with them to translate findings into practice. In addition to working closely with communities, the Partner team are currently conducting national network evaluations of the Baltimore Integration Partnership, the Kids Count Grantee Network, the Million Hearts Initiative, and have completed evaluation on the Hospital Preparedness Program. Today, Danielle will present on network evaluation for network leadership. So at this point, I'll go ahead and turn it over to her. Okay. Great. Well, thank you so much, Melinda, for that introduction and for introducing our seminar series. So It's a pleasure to have everyone on the phone today. Our team works on network evaluation in many different aspects and are really open to hearing from folks from all over the country all the time. So at any time after this webinar, if folks are interested in connecting with us, please do. Today, we're going to just present an overall framework evaluating networks for network leadership. What we're going to do is go over first discussing a network science approach to evaluation. This is kind of our motivation and way that things are working in terms of how we think about things. And then we're going to do a presentation of the evaluation framework that we use. Of course, it's premised on social network analysis. This is by no means a webinar on network analysis, but we will describe what that is, and then specifically how we use the partner tool and survey for that work. And then we'll do some examples of using this kind of evaluation for network leadership, which is really a focus on thinking about translating it into practice. All right, so just to get started on some network science background on this, this is a slide that I use almost in every presentation. It comes from MAP, which stands for Mobilizing Action for Planning and Partnerships, and the web link for this is at the bottom. MAP is a terrific framework for community collaboration, really focused in the public health sector, but it is a great user community, really takes you through all the steps of strategically thinking about bringing partners together and getting them to outcomes. But the thing that we like best about this slide is this last line, which is the shift from the idea that agencies know all to the idea that everyone knows something. And so the reason that this really speaks to our work is because we know, so whether you're in the private, public, or nonprofit sector, everyone is working across boundaries now. And it used to be that we would hire people in agencies that really knew everything. We wanted the most expertise in the person we hired to come into that position. Today, we need something more. We want people who know what they're doing and have a lot of background and education skills in an area, but we also are focused on hiring people who know where to get information. Because of this idea that everyone knows something, we rely on people now who can engage in collaboration, build partnerships, find information, and be able to bring that back to our own agency. So it's really changed the nature of the way we work, even the job competencies that people need. So one of the issues that we know happens now is that we have people working in organizations who are expected to work across boundaries and be network leaders. However, they really aren't having an opportunity to build the skills to do that. And so that's what our focus on network leadership is all about, is really helping people build the skills to be good network leaders as they go into those positions and engage in this network way of working. So this is another map that comes from the MAP program. It's a network map. And the reason I like to use this a lot as well is because a lot of people who are in the like, drug treatment centers are connected to home health and so on. What's interesting about this map, though, is it's meant to conceptualize the idea that the public health system is not a siloed system, but really integrated across different sectors, across different boundaries. So working across boundaries is really becoming a core function of organizations, and thinking this way is something that, we're not really doing trainings and webinars anymore on why partnerships are important or why it's important to break how to do that. So I think most people probably on the phone are on the same page that we're doing this work, and this is not feeling like new information, but it kind of helps us explain what we're going to talk a lot more about in terms of networks in a minute. And so the network science perspective is one that we bring to this evaluation work. So network science research and tools really do provide a unique framework for this work. And what we're trying to do is to provide an additional way to evaluate partnerships. So the current assumption by which most partnerships or networks are evaluated is this idea that more is better. And this is a current assumption that's been a current assumption since I've been presenting the slide for 10 years. The idea that more partners might lead to successful collaboration, or as someone once said to me, counting noses. It's something that is ingrained in the way we do this work. So for example, let's say that a community gets some funding and it's to build a community network. The funder typically wants to know what you're doing with that money. So let's say 6 months into it, they want to report. Usually you will list your partners and how many meetings you've convened with those partners. A year into the funding, they might want to know now what you've been doing. And what people are doing today is listing more partners and more meetings. And there's really, it's very difficult to go backwards and say we have fewer partners and fewer meetings, because then the funders will want to know, well, what are you doing with that money? So an alternative assumption is really that less can be more. So a network science approach allows us to look at not the number of partners we have, but how they're connected. So I'm going to use these images at the bottom of this slide to convey this. So this, let's say for a moment that you imagine this little red dot is you. And I mean you as an individual, not you as an organization. And imagine all the people that you spend time with on the weekends. These are the people that we are closely connected to because they're a lot like us. They like the same things as us. They do similar things that we do, and they might even have access to similar resources. We call these our strong ties, and we're all embedded in our social sub-networks is what we would call these. And this is happening. Everybody on the phone has their own social sub-network. And for all sorts of reasons, we connect across those social sub-networks. So there's a guy named Mark Granovetter who did his dissertation work in the 70s, a sociologist, and you probably, some of you have heard, some will be new to the idea of the strength of weak ties. But the strength of weak ties was this concept that Mark Granovetter talked about because he said, you know, I want to find out how people get jobs. And he knew we got jobs through referrals, but he suspected we got jobs through these close referrals. And what was so kind of groundbreaking about his work is that what we found was that we actually get jobs through these friends of friends, through people who are not a lot like us because they're different from us. They know things we don't know about, like availability of jobs. So the strength of weak ties is really a big premise of a lot of network science. But if we continue to just function like this in kind of this chaotic way, then it actually can get overwhelming. As an individual, not that big of a deal, but as an organization, this can be pretty problematic because we have a limited number of hours in our workday, a limited relationship budget by which we can actually manage to engage in these ties. This kind of work is it costs a lot to our organizations. So we need a strategy. So over here is a different picture. And this represents a concept by a theorist named Ron Burt, who said, hey, let's take advantage of connecting to these social subnetworks, but let's reduce redundancy. And let's make sure that we don't have a whole bunch of repetitive ties that are costing our organization a lot of time and money. And so in this perspective, by creating what he calls structural holes, we still gain our collaborative advantage to connecting to social subnetworks, but we get an extra advantage because we can connect to new relationships and other social subnetworks. So let's say this is a hard to reach population with a gatekeeper in the middle of it. It's a gatekeeper holding us to the gate to helping us get through into that network. We would want to make sure that we have a strong, trusted relationship to that person or organization that can help us connect to the rest of the network when we activate that tie. So the whole premise of this is not that we don't have ties to all these other networks, but that we are keeping one where we're putting some resources into it. And we've kind of gone through this in order to get over here. And we're thinking strategically, though, about how we can manage this relationship budget to have fewer connections, but get the same advantage. And in fact, a better advantage because we can have now new relationships to new other types of social subnetworks. So what I always like to say in these kinds of talks is if you go away with one thing today that you can remember from this webinar, it's that there's a different way that we can think about the way that we're working across boundaries, that we can be strategic about them, that we can manage these relationships, and we can think about when we want to activate a tie and when we don't, and how that's affecting the resources of our organization. But the second thing that is important about this is that you really can't do this kind of work unless you have data or you have some intimate knowledge of what's happening in these networks in order to make these kinds of decisions. And so that's where evaluation comes in, and the partner tool is based on this idea that we're helping communities provide information and data to collect to do just this kind of work. And so that's the framework which we're going to keep talking about. All right, so a little bit about our evaluation framework. I said I would talk a little bit about network analysis and the framework, but basically we kind of look at systems as networks, and that's the perspective from which we're coming from. We use this kind of evaluation to evaluate how well a collaborative is working in terms of meeting network goals, including things like identifying essential partners, gauging levels of involvement, leveraging resources, and strategizing for improving the work, translating the work back to practice. But we also have a need to demonstrate to partners and stakeholders, evaluators, and funders how the collaborative is progressing over time and why working together would make a tangible change. So this picture over here on the right is actually from a resource that we have on the website, which is a simulation. And if you want to practice what I'm talking about before you go in and you do this work, you know, for real, you can go in and find a simulation under our resources that sets up a scenario, gives you some data, and gives you the opportunity to think about using data to make some management choices. So that's what this map is from over here, is from that simulation. So it really speaks to what we're doing today. But before I go into much more, what I really want to do is do what I call some normalizing around this topic. So what are network outcomes? So what is an evaluation that has network outcomes? So networks, and I would even argue systems outcomes, are different from things like population or client outcomes. Rather, what we're talking about is some intermediary outcomes, the process outcomes that happen between building a network and linking to those actual, for example, client and population health outcomes. So for example, in this picture below, you can see over here is where we usually start. We're building partnerships for some kind of systems building, whether it's a community collaborative, a provider system, whatever it is, and that usually involves convening stakeholders, doing maybe needs assessment, talking about leveraging resources. And the goal is to link them to outcomes, like, for example, children and family outcomes. Of course, this is what we want to do, and this is what our funders want us to do. This is the ultimate final product. But the problem is we're often skipping the middle of what's happening here, which is that process that's happening. So in these kinds of outcomes, we are measuring things like perceptions of value and trust and authenticity of the process, perceptions of goals and outcomes, and then real measures of coordination and efficiency and redundancy. The context in which I'll talk about it in is among organizations, so interorganizational networks, and set in community context. So what I always try to argue, especially when funders ask us to do this kind of evaluation for them, is that if they're going to fund process, if they're going to fund network building, then we need to also fund evaluation and allow evaluation that looks at the process. Because what we know and what people have become accustomed to accepting is that if we have a good process of building a network, it should lead to these outcomes. I believe that this outcome between partnerships and child and family outcomes is more of a research question, and we need data in order to do that. But the evaluation piece is a lot about improving that process so that we can get to those better outcomes. So our focus is on how can we use the information to manage that system or manage that network. All right, so last normalizing slide is this one. So in network evaluation, context is important, meaning that we can't just evaluate networks thinking we're going to compare one network to another. Every network has a backstory, and although you can spew out lots of network scores, what's really important is to understand the context in which that network is functioning. And so for that reason, we can't not consider or involve the people who we're studying in the evaluation. So we take a community-based participatory approach in all of our work, and it's crucial to us that we have people who are part of the network involved in all parts of the evaluation, designing the study, collecting the data, and interpreting the data. But another thing we do is we have something we call the partner quality improvement methodology. So sometimes in an evaluation we use this, depending on kind of the context of the evaluation. And what we do here is we spend time with a community or a network identifying what they consider their ideal network. So we give them some network science thoughts, and then this picture that you're seeing on the screen is an actual activity that we do with people where we have them build their networks with thumbtacks and rubber bands, and we have them think about things like more is not better. And you'll see things like one node, one thumbtack in the network will get all kinds of rubber bands coming to it, and it'll pop out of the board. And that's an important point because it's really symbolic of what's happening in real networks. We tend to overload an organization or two with the responsibilities of the network, of organizing that network. And we have to make decisions. Are we going to reinforce that? Are we going to add rubber bands to those ties? Or are we going to restructure the network so that there's more equality in the network of how the network is being managed. So once people do that, they do this ideal network exercise, we go in and we'll measure the actual network. We use partner, lots of people use other kinds of network approaches, but the point is that what we're able to do is identify the gap between the actual and the ideal network. And what that allows us to do is create some action steps to get closer to the ideal network. So rather than saying your density score is 50% and trying to arbitrarily interpret that, what we do instead is we say, here's how we've measured your network. Here's what you said you thought would be your best network, and we're going to help you think about ways to create action steps to get closer to that. The way that we can compare across a set of networks is we can compare to what degree those networks are close or not to their ideal. So we can give them percentage scores. So we do have funders who want us to score networks, but that's the only way we'll do it, because we cannot get away from the fact that these networks are so contextual and that people in the network are not going to respond to the network data, what you're trying to present to them, unless they're going to buy into it. And that means they have to be involved in helping in with the interpretation. All right, so this is our actual framework that we use in our evaluation. So we have 4 pieces of the framework that we emphasize. The first is interrelationships. So like almost all network studies, we study the structure of how network members are connected. So these are literally measures of that you see in typical network studies of, you know, who's central to the network, how they're connected, measures of whole network scores and things like that. But we do a lot more than that. And so what we find really interesting and important about a network study is that we're collecting data on the way that folks are describing relationships at the dyadic level with one another. For that reason, we're also focused on attribution. So because the world of networking today is so structured around funding or legislation that is mandating this work, some of it is not, some of it is just more holistic from a more community perspective. But still, we want to be able to explain the formation and evolution of these ties. So we want to give attribution to why these ties form. If it's a funder, if it's a backbone organization, we do want to be able to say it was because of that, so that people can know that their investment in these networks is working. But we also want to explain this because we want to know what motivates people to stay involved and to keep and ties over time. We also measure perceptions, and this is a core piece of the partner survey. We measure and get a sense of the understanding of how members perceive relationships, for example, things like the value of partnering. This is important to us because we know that there's no real measure of a relationship. There's only really the measure of the perception of that relationship. So understanding the perceptions that folks have of whether that network is functioning, whether that network has good leadership, whether there's value and trust among the partners, understanding that enables the network leader, gives them so much information about how to manage that network. So perceptions is a really big part of what we do. And then finally, our evaluation framework is focused on agreement. So the degree to which network members are kind of on the same page. So even if everyone is saying that the network is low functioning, the fact that everyone is saying the same thing is actually a proxy measure for something good happening in the network. When people are in disagreement on the answers that they're giving in the network, we use that as a way to tell us that there's a lot of work to be done about thinking about the strategy, how we define success, and how the network is working. So agreement is our 4th domain in which we conduct our evaluations. All right, so our focus, though, I've been talking a lot about this, is on translating the network data to practice. So alone, these pictures and data are interesting, but really what we are trying to do is utilize these concepts of network leadership so that we can focus on strategies. So my last kind of slide on this section is really about what I call the evolution of a community network. So this is really looks like an old slide because it's one of the first ones I ever made when I wanted to kind of communicate all the stuff that was happening in my head, and I wanted to tell people what we were trying to talk to them about. And so this was the first slide that we made. So I want to draw your attention to the middle of the slide. In the circle, you'll see these dots and squares. These dots and squares in every picture that surrounds it do not move. They're in the same position. What's moving, what's changing in each of these 4 squares are the lines between them. So the first point I want to make here is that we can manage networks, we can change relationships, and we can do this with intention. And that's what's happening here. So let's go through this evolution. I start in the top left corner. This is, let's say, a community group, and they're working on an issue, let's say, reducing tobacco use in the community. They get some funding from our tobacco tax money, and what we find is that they come together. The first activity that usually happens is everyone comes around the table who's kind of working on this work. You know, maybe there's one organization kind of coordinating everything, but we kind of get a sense of who's already working with whom on what. The first conversation we have is who's not at the table. So that's these isolates over here. And we make some decisions about who to invite to the network, right, at our next meeting. So over here, we go to connecting the network. And our goal at this point is to have no isolates. Let's get everyone at the table. Let's get our powerful and influential people at the table. And let's go ahead and make sure that we're fully connected. Down here is where, in increasing density, is where most networks stay for the remainder of their tenure. They never leave this box, meaning that we have the most meetings we can with the most amount of people, and we're not really sure what our strategy is. We just know that getting everyone around the table as often as possible is somehow meeting our goals. So here's what's happening now, though. Down in the right-hand corner, we have folks who are shifting their thinking and thinking, I can manage these relationships. So down here, we have creating subgroups as an example. So let's say now we have four, a core group of four. They meet more often than the rest, but they manage these sub-working groups. Sometimes we have to shift all of that. These work groups, we're only activating those relationships when we need them. Now people have roles. They know why they're coming to the table. We're asking people to come to the table less often than we were before. And for that reason, people are going to stay engaged longer. Lots of research shows that networks that are sustainable are those where people have a role and they feel like they're engaged. And we also know that maybe once a year we do this. We get everyone together, or maybe more often. But the point is that we're not always in this bottom left-hand phase. We are thinking about how to ask people to come to the table less often. We're telling our funders we have fewer connections, but let me tell you how high quality they are and what we're doing when we connect. And so what's neat about this is that, we have what we hope for, which could be more sustainability in our network work. What you'll also notice here is that you won't see, we always start with kind of a backbone organization, as the collective impact folks call it, or some coordinating agencies. That's pretty natural. That's kind of been the way networks have evolved always. But what's important is that when we've seen this in our research is over time as networks evolve, that really needs to equalize. The power needs to keep sustainable, our flat organization. So if you continue to rely on one organization to manage that network, always, what you're going to start doing is getting engaged members, disengaged members who are feeling like they don't need to be involved because there is a coordinating agency that's going to take care of all that work. So we've really found over time in our work when we create strategies with folks that there really needs to be a focus on kind of, getting that coordinating agency to become more of one of the network or vice on the other side of that, getting more people involved in that leadership piece. All right, so just in terms of collecting these data, so I'm talking about network analysis. All I'm going to say about it is that it's a method to gather and analyze data that explains the degree to which these network actors connect and then the patterns that they create. So this is a definition from Scott in his handbook from 1991. The neat thing about networks is that, we collect data on who's connected to whom, how the connections vary and change, and there's nodes and lines. Those nodes and lines the nodes can be people, organizations, or things, and the lines represent the relationships between them. The way that we collect that data through the partner tool. So I'm going to talk about that for just a minute and then spend the last part of the webinar showing some examples of this. So partner tool is found at partnertool.net. It stands for the program to analyze, record, and track networks to enhance relationships. So this tool was created with support from Robert Wood Johnson Foundation about 10 years ago, and they funded it for about 7 years, and the tool was always free. At about 7 years, they asked us to create a sustainability plan, so now we charge a small fee. So communities who are nonprofits or public agencies pay $50 to use the tool, and private agencies or evaluators pay $100. And then we actually provide some services like reports or trainings and things like that, we're not trying to sell a tool. What we really want to do is actually sell the idea that we're using with the tool. So what Partner is a quality improvement tool using social network analysis. We have a validated survey and methodology, meaning that there's a survey that is set in the Partner tool, and it's got 18 questions. And I probably wouldn't have said this a few years ago, but now I'm 100% certain that this is the best survey that we could use to do the kind of work I'm talking about. That methodology is embedded in the whole program, and then it's connected to this analysis tool. So what that means is that the user collects data using an online survey system like SurveyMonkey. It's embedded in the online system, and then once they get the data, they just dump it into the analysis tool, and there's no data cleaning at all. It just lays it in there, and it provides all this stuff that I'm going to talk about in how you might use the data. I talked about the QI methodology. We have over 600 users in all 50 states and 30 countries. About 90% of those do come from public health because of our Robert Wood Johnson support and all of this. And to be honest, this number is really about 800 users now, but we maintain a data set, and we have only cleaned it up to 600. So there's lots of other users out there, which really helps us know that we're doing something right and it's resonating at the community level. Most of the folks who use Partner are practitioners, evaluators, or researchers, but the tool was designed for practitioners, and that is its focus, and that's its primary purpose. The mission behind the tool is to really build capacity at the community level to do this kind of work, especially if you don't have the money to hire an evaluator or researcher. So we try to provide a lot of support for folks on how to use it without them having to pay much for that. So each of these 600 represents one network, and they vary on all kinds of topics. We have lots of public health topics, but we also have folks who use it in environmental policy, education. It's not a public health tool. It's just the context in which most people have used it. What makes it unique from other tools is a validated survey that I talked about, the link to the analysis tool, and that it's flexible, but it has enough formatting to still be user-friendly. Like, you don't have to clean the data because of the way that it's programmed, but you can customize it for your own study. What it's done by using it over all these years in all these communities, we hold in our research lab the largest whole network data set of networks collected by surveys using the same methodology and basic set of questions. So our N is around 800 whole networks now. We have in that data set 16,000 organizations and 100,000 dyads or so, and this just grows and grows. The reason this isn't related to evaluation is because we can use these data not to compare network to network, but to look at a network as it relates to this larger world of whole networks. So we have, average numbers of trust. We can pull out subsectors of these large data sets and look at how, a chronic disease prevention network might look in a few communities as it compares to this one. We don't actually identify any of those organizations, and if people who use Partner don't want to include it in the data set, they just tell us and we just take it out. But this is what we do most of our research on, and where we really try to link to outcomes is really embedded in this work here. So how it works is there's, like all surveys, one person who collects data and then members of a network who take surveys. There's 4 steps that you have to follow. So one is bounding the network. The next one is modifying the survey, sending emails to respondent, and then analyzing that survey. We do demos about every other month on how to use Partners, so I'm not going to really go into this. The only thing I'm going to say is that first step, bounding your network, is probably the most challenging for all networks. It's a huge issue. It's a huge component of a network evaluation. And I'm not really going to spend much time on it today because we spend time on it in other ways, and it would really just take too long. The only thing I am going to show you here a little bit is our survey. So this is a worksheet that is available that you can look, but it's important to understand what we're asking in order to understand how we're actually evaluating these networks. So the first 9 questions in our surveys do things like ask people what they contribute, and it's usually from the organizational perspective, and outcomes that they might think the network needs to work on or are already working on, and things like how much success the network has had. But here's some relational questions. So in the network survey, there's always a question where you have to identify your partners. That's question 10 in our partner survey. But on question 11 and 12 are relational questions, We actually, in our own evaluations, never ask frequency of interaction anymore because we find it to be kind of an unuseful way of analyzing and looking at relationships. But it's part of our default survey that we haven't changed. We do measure type of relationships, but we also use these questions to look at attribution, why a network tie was connected, and what they actually do when they are connected. And then we measure perceptions of value between partners, measured as power and influence, resource contribution, and level of involvement. These are really important to us because most people who bring network members together focus on folks who are powerful and influential. But we find it really important to also focus on those who have no power, no resources, but might have a lot of involvement. Those people are crucial in helping us run and lead networks. So we like to know those perceptions of people. We also measure trust, but we ask people to rate their partners on reliability, mission congruence, and communication. So these are all items that we created by doing a lot of qualitative work years and years ago, where we asked people how they valued partners and how they described trust. And that's how we turned these into these scales. After we collect data, we manage the data by uploading it into the partner tool and analyze it. All right, so what I want to do is get through that real quick so we can just spend a couple of minutes here looking at a few examples. So I'm going to show two. So the first one is on describing networks. And so we've done a project with the Early Childhood Councils of Colorado. These are legislated networks that have to come together. The context in which they're convened is legislatively they've been required at the county level to convene these early childhood councils. The actual council is an organization, Early Childhood Council is an organization that acts as a backbone organization. So what we did is we administered the partner survey at 2 points in time to look at things like how the Early Childhood Council in Colorado is strengthening the early childhood system, what parts of the network are strong and weak, specifically in two areas, and how the system is interconnected, so which parts are impacted by which other factors. So what does that system look like? What we found was when we gave that survey at time 2 to 12 communities, we got information on almost 6,000 partnerships. We call a partnership a dyad, so any two organizations in the network and the relationship between them. That was information was provided by 394 respondents, so I'm aggregating it here. Of those, 3,755 of them said that those dyadic partnerships were attributed to the Early Childhood Council. We have a big question here by the legislators, which is, what is our work doing? When we legislate these partnerships, is it making a difference? Are we building an early childhood system? Well, almost 2,600 of those partnerships that were described said that they were developed because of the ECC. So this is where we're looking at attribution, and here we can say the Early Childhood Councils in Colorado are responsible for over 2,600 relationships, partnerships. And then another 1,100 of them said they were already developed but strengthened by the ECC. So this is really important. We feel like we hear story after story from these early childhood coordinators who say, we know we're doing systems building work. We know that we're creating these partnerships, but what we're doing here is adding numbers to that. So here's just some real typical ways that we look at how we break apart these sectors. One way of looking at that, for example, one piece of the pie in a typical study might look like this network map on the right. Those 674 pieces of the pie actually looks like this in a network perspective. And I'm gonna kind of skip through these a little bit. We looked at here, this is a way of looking at attribution, and then a slide on what they're actually doing. So this is our number of relationships in terms of each of the areas in which they work, and then how these vary across the different counties. But we want to focus a little bit here on these QI examples. So what we mean by that is, how did they use the data to turn it into some work, right? So here, for example, they have a mission that they wanted to increase partnerships around home visitation. So we were able to ask the members of the network to describe their type of tie and who they have connections with. And so here's our home visitation network. And what a lot of our coordinators are able to do now is look at, rather than say, we think that some of these relationships are existing, they can go into the data and look at it in this level and understand how they can start to build on best practices and connect folks who are not connected or who already are. So this is a way of using the data at the dyadic level. But we also asked folks to look at, so here it is again, you can see a head and a tail, and what they say about one another. This is really, really valuable information for a network leader to be able to look at it from this perspective and understand how the members of their network are interacting and then use that information for practice. But here's one, for example, when we looked at those perceptions of value and trust, for example, in this case, the blue was all members' average perception of value among all the members of a network. So this is one network. The red was all members' perception of the ECC, the Early Childhood Council. But the green was the perception of the Early Childhood Council of their members. So what we see, anything below a 3 is considered a little bit problematic. But for example, here under research, that very low score on their resource contributions that they are getting from their members. So what we were able to do is say to that coordinator, you can actually go into our list of resources that people can say they contribute and start using, we use this as like an indicator that this network leader needs more help in leveraging resources. And then we link it over here to say, here's the resources that people say they can leverage, so let's start creating some action steps around that. And then finally, just communicating results. We created these for each site in these 12 early childhood councils, where we call this a bragging document. It's really for them to just say, we are doing this work and here's all the best things about it, but our focus is on quantitative numbers. So therefore, these numbers of partnerships and the attribution and agreement among their members. So a lot of folks who we worked with just put these right into their annual reports, which was really great because we felt like we finally figured out a way to communicate some of this to a lay audience. And then finally, something that is really important to almost all networks we work with is the grant language. I'm sorry, the sustainability. So what we did is we turned a little bit of this into some granting language so that they can use it when they're applying for grants. So what we did is we took all the information we got in each of the sites and we wrote up these paragraphs for them that they can cut and paste into a grant application. We, as a reviewer of grants, I often review an application that's asked the applicant to describe their partnerships, and they usually list how many partners they have and how often they meet. This is a way to give folks who use this kind of evaluation kind of a competitive edge and describe their partnerships in a different way. All right, and so just really quick, so I want to leave some time for questions. I just wanted to focus on this for a second, which is linking networks to outcomes. We did some work looking at the system of care for babies and young children with special healthcare needs in Colorado. So we asked a lot of folks from the community to answer questions about who they work with on this system of care. We know this system of care is very complex and people are having a really hard time navigating it. When we did a typical network study, we got what looks like every other network, which is a core periphery structure with this core being circled here. But we got lots of reports of collaboration and lots of programs that are happening, and the results look like a pretty strong network and a lot of good things happening for this population. We were even able to pull out things like mental health agencies and see if they were connected, and even look at it by different counties to see the difference when you go to rural or urban county. But the problem with this, we started disseminating this information, and when we presented it to families who are embedded in the system of care, what we found was that it didn't resonate at all. Families said, it doesn't matter how many of those systems level people tell you they're working together, I'm still having trouble navigating this system, and it's very complicated. And this is, for example, a family with twins with special healthcare needs trying to describe how complicated it is for them. So we started giving a network survey to families. We realized our outcome measure was not the network level. It was actually a family's personal support network. And when we started looking at personal support network at the family patient-centered level, we saw something really different. We saw that their social support network was made up of extended family, pediatricians, immediate family, and none of these system-level partners. So we started looking at that more specifically and tried to find out more about those personal support networks. So now what we do with this, I'm going through this really fast, is we realize that if we want to have a measure of whether the system of care is high functioning and well coordinated, we actually need to have more information about personal support networks. And the closer that, 100% of families are telling us that their personal support network is coordinated, then we know the system is actually working. So we've really shifted our work, and we're actually creating an app right now that we're using in clinics where providers collect data on a social support network. They work with patients to collect information on their social support networks, but also all their social needs and things like food, housing, transportation. But what we do is we add on to that the degree to which they might be isolated, the degree to which they have a well-supported, strong network around them. And we use that as an indicator for where a patient might need more assistance or not. And through this app, the provider links those assessments to community resources for those patients. So we're finishing that app, and we're actually going to start using it in different settings. We believe we can use this for systems of care for babies and young children, for long-term support, cancer patients, and also even in schools, a place where maybe social workers can help us think about how kids are embedded in strong or weak networks. So I wanted to give that example as a way that when we started evaluating a system and halfway through realized we didn't even have the right outcome. So what I'd like to do is stop there so we leave some time at the end for questions, and I know Melinda is going to kind of facilitate the Q&A for us.
Wonderful. Well, thank you so much, Danielle. Really great presentation, and thank you for all the great questions. I was thinking I was going to group them based on the overall topic. So the first couple of questions that we have are related specifically to the partner tool, some of the more logistical aspects. One person wanted to know, when is the next webinar of partner going to be? Oh, the demo. So I know several people on my team are probably going to kick me for this, but we haven't scheduled it yet. We had to reschedule it based on a few things. So we're planning to do one in March, but if you check our website at partnertool.net, in the events section, we'll post it there. And if you want to just stay on our list, we also email out folks, so just let us know. But we do that about every other month, but you can also, we have a YouTube recorded version of it you can always watch, and on the partner website, there's a whole bunch of short web videos from like 2 to 10 minutes long, or 2 to 7 minutes long, and it kind of goes through the whole demo. We also have a technical manual that you can pull up if you're a reader, if you like to read things. So we try to make it as much as possible for people who just want to build their capacity to use a tool like this to do it on their own. And then, we almost try to talk everyone out of actually working with us on that. But so we'll post it, and I'm so sorry I don't have the date available today. Great, thank you. I have a person who asked, can you use partner if you've already collected data?
So not really. There could be a way that you could go back, but it's not like that. It's not. So most folks who are familiar with network analysis on the phone probably know about UCINet, which is like the top of the line network analysis tool, right? UCINet would be a better tool for you because that's what it's designed for, is you take any data you have and you go and you put it in there and then you design your analysis. The thing about partner is that the questions are pretty trademarky kind of partner, especially those value and trust questions. And unless you asked them, it wouldn't really make sense. And I just talked about it having 18 questions, so I've seen someone try to do it before, and it really there wasn't much utility for them. So it doesn't mean you can't maybe interpret the data that you have in a similar framework that we use. And so offline, feel free to contact us and ask those kinds of questions about your specific projects.
Great, thank you. And then I have a question about, is there a way to keep your data confidential if one uses the partner tool?
Oh yeah, lots of partner questions. So they for sure, if you, when we get the data into our system, it's already considered confidential. It's anonymous to us. It's just coded as XYZ. However, we have many people, or some actually, who just say, we just don't want to share it, and all we do is take it out. We never include it. So it doesn't prohibit anyone from using the tool. I mean, we're at 800 whole networks, and it's okay if you don't want to include yours. It's going to be not a problem.
Great, thank you. And I might come back to some of the more partner-oriented questions, but wanted to, a lot of the information to answer some of those questions are on the website or through the demos that you can watch online, but wanted to go ahead and get to some of the other questions. So we have one that says, is there data to show that better networks, good process outcomes, create better client outcomes?
So can you read that again?
Sure.
So,
yep.
Yeah.
Is there data to show that better networks, good process outcomes, create better client outcomes, or is this our working assumption?
So for sure, it's a working assumption. And one reason that what I would kind of refer to is probably the 30 plus years of network research, right, that has got us to this point where we are today, where it's a working assumption, this working network way of working, the reason that funders are funding it like crazy, the reason that you can't even walk into your job today without someone probably asking you to build a partnership with someone else, is because of all of this research that has shown that we are better when we work together and we can address difficult, complex problems in more feasible ways when we do that in a coordinated, collaborative way. You know, Eleanor Ostrom was one of the ones who I admire the most and who thought most about this when she presented collective action as a framework and talked about how working together we can address community. Really, the reason that she won a Nobel Prize for this is because it spoke and to all of us, and it makes sense in the economics world, it makes sense in our social systems world. So there is lots of research, and you know that's something we could provide offline as some examples of research. But I'll be honest, I think that we do need to get a little bit away from assuming that you know, having more meetings is shifting the dial on child and family outcomes without better understanding how we're measuring the process in between. So so definitely a working assumption that I'm not even going much into because I'm thinking it's such a normalized assumption these days.
Great, thank you. And we have a question that says, what are some actionable strategies to change organizational culture towards valuing network structure changes and strategic realignment?
So this is a really good question, and it's a great question actually, because whoever asked that question, I can tell is embedded in a network, because making a cultural shift in a network is extraordinarily challenging and could be the end all, right? It's the first part of saying, you know, we can't really move forward unless there's a cultural agreement around this. But I think that folks are thinking in a different way than they were years ago. And so, you know, a strategy that I would use often is that, you know, often we bring groups together and we ask everybody to identify who they are and what they do. And immediately we set a culture and a tone that we're individual organizations and we all have something to contribute, and it probably has something to do with our individual missions. I would suggest that a different approach is that you bring groups together and you talk about the common goals before you ask anyone to introduce themselves and self-identify. Immediately you're setting the tone and the culture around the idea that we're doing something together, we have a common outcome. Then you backtrack into that and say, okay, now organization A, organization B, what is it that you do as part of your work that can contribute to this larger outcome? And what you do is you shift people's thinking from I'm here for me to I'm here for this common goal. And last thing I'd say on that is you give people an out. You say, look, it looks like you guys do great work, but it's not contributing to the common goal right now. So we love to keep you around the table, but we might not have a role for you right now. And make sure that you're actually focused on the commonality and you know, getting away from the what do I get out of it by being a part of this group. So that's a really hard question actually to answer in about 30 seconds. So it's one I'd love to talk more about actually.
Great, thank you. And we had a couple other questions that sort of related around that theme. So hopefully that helped clarify some of your questions. So I have a question here that says, over the past 5 years, collective impact has become the new kid on the block with respect to collaboration and partnerships. Can you comment on how this has influenced or impacted the work that you've already been doing in networks? Is it just a terminology thing? Just curious.
So this is a good question. And so the value that collective impact has brought to this work is amazing. And we're so fortunate, I think, that, you know, we finally are able to get ourselves around some common language and some things that people feel are really tangible, especially in this funders world. You know, funders want to know what the heck are they funding, right, when they fund partnerships. So it's been a really great way for, I think, people to come to common language around that. Being an academic, I probably will take a more academic view than some of the others and say, you know, what collective impact has also done very well is is summarized, at least in public affairs where I'm from, 30+ years of network research that has, pointed to some of these aspects as ways that networks function well. My concerns for collective impact are that it's a framework that I see a lot of networks, especially I work a lot at the community level, that we're really trying to fit into it. And it's difficult to fit into a common framework across many, many different contexts. And so I would encourage folks to consider lots of frameworks, like the MAP framework, or the one that Joe Mendyka is going to present on next week is another version of that from a funder's perspective that really allows you to think about things that, some of the 5 tenets of collective impact might be emphasizing that might not fit for your organization. And the only thing I would also say about it is that it does emphasize a backbone organization, which I think, like I mentioned, all networks are usually brought together by some convening organization, and that's kind of been the way networks have evolved over time for years and years. But I'd be cautious to think that we need to keep a backbone organization as the coordinating agency for taught me and many others about collective action is that if people do feel like there's a power imbalance, or they don't feel like they are all fully contributing, and they're not even asked to fully contribute, they will check out and they will start to rely on one organization. And for that reason, it's concerning when I see how networks evolve, that we might be pushing more towards keeping networks centralized, when what we know about sustainable networks over time is that the most sustainable networks are decentralized. There's a lot of equality in the network, and everyone's being asked to contribute in a real equal way. And so when you do a network analysis of a network that's been around for a long, long time, you don't see very much variability in the network. It's very hard to interpret, actually. Everyone knows everyone. Everyone has high trust of each other. That's good news, because that means that network is probably on its way to more sustainable capacity than one which is reliant more on a single organization. So obviously I have some opinions about it, but I am really grateful for being able to have common language around it. But yeah, I would encourage people to really just make sure that you put it in your own context.
Great. Thank you. And kind of relating to some of what you said, someone asked, is there any good research that demonstrates the value of equalizing the power?
So, I mean, it is, I keep going back. I didn't realize I'd talk about Eleanor Ostrom so much on this webinar, but the premise of collective action, the premise of why people come together through social movements or, any kind of community grassroots organizing is the premise that people are equally involved, that their voices are equally heard, that representation is real and authentic in these networks. And so, I think there's plenty of research along the spectrum of economic sociology to public affairs and all sorts of other areas that really do show that when people feel like there's a power balance, that they are more likely to stay engaged and not engage in behavior where they're taking advantage of one another. So that's it's a real theoretical kind of question, I think, in a way that has been addressed over time. But, on the other side of that, I said throughout this whole webinar that we need to make sure that people have roles, and we're not asking everyone to do everything. So I'm not implying that, everyone has a lot of work in the network. You still need to delineate who is doing what, and people still need to have different responsibilities. That's a little different from issues of power and equalization and the feeling that people the feelings that motivate people to stay engaged in work. I mean, we're talking about interorganizational networks where we have very little accountability. There's no one saying you have to be a part of this. And even if they are saying you have to be a part of it, it's very unusual to have accountability mechanisms for making sure people do what they say they're going to do. So what we are banking most of this working across boundaries premise on is actually making sure that we're keeping the motivation of people and what they're there to do and why they believe in it high.
Great, thank you. And I know we're coming to the end of our webinar time, but we'll maybe just answer one or two more questions. This maybe might be an easier one. Is a parent-centered tool available, and when and where will it be available?
Oh, sure. So we call it the Patient-Centered Network app.
and it's just getting programmed right now. And I'm actually, I'm happy to say that I've won this award from the Community First Foundation to be part of the Innovators Society. And so we're competing with 5 other organizations to do a community-wide pitch on this, an innovation. And our innovation is this tool to really help to bridge some areas of mental health wellness that are lacking right now. So we're keeping the tool right now because we're still testing it. It's super important to us to validate the measures and make sure that when we say to provider, when you assess a personal support network this way, it means this about the patient. So we're validating that in many different settings. So our plan is that it would be available in the fall for use. And since it will be an app, we're developing it as an Android app, so that's the first way it will be released. So I would stay tuned and check on the website. You bet when we get that ready, we're going to try to make it available to people.
Great. And then this question is a little bit different from the others, but how do you do this work when the network is individuals, not organizations, and the connections are between individuals and the focus may not be funding?
Yeah, so what your question is about is an interpersonal network. And I'll be the first to say that that's not an area I spend a lot of time on. But the history of networks and how they were studied, even within organizations, was usually within an organization among people, studying teams or how people interact. One of David Crackhart's first studies, I think it was his, on like whether friends were the same. People got advice from their friends if they tended to rely on advice in an organization more between friends. So the partner tool actually is just a tool. So I've even done it, I was studying students, and I put in people's names, and I had to modify the question. So what's different about that is that what you wouldn't want to do in an interorganizational study is use people's names, because even though it's sometimes hard for people to think about how their organization connects to other organizations, it's even harder for people to conceptualize their working relationships person to person. So that's why you wouldn't want to do it in that way. But if you did want to ask interpersonal network relations, you would just, that would be the focus of your study. You would list people and you would construct your questions in a way. So the partner tool is really designed for interorganizational community level studies, but you can modify the questions to ask anything you want about folks. And so, and of course you might not, in fact, in our patient-centered network survey, we ask people, our primary question we say to them is, who is part of your social support network? Which people, places, and programs are part of your social support network? And they just talk about their interpersonal relationships and how those interpersonal relationships support their children with special health care needs. And so it's just a different way of studying, and there's a whole literature out there on doing that work. So I think so. So we are getting to the end. Since there's still quite a few people on, we can maybe answer another question or two. Sure. And if folks need to drop off, go ahead. We're going to have this recorded, and it'll be up on our website. And like I said, our partner team, I have an amazing set of people who work on these projects, and we answer a lot of emails. But our goal is to help build capacity, and so if you do have questions, we'd love to connect with you offline. But I'll go ahead and answer one or two. Sure. Since
we have a question that says, why is agreement so critical? If everyone says the network is underperforming, why is that a good proxy?
Yeah, so that's a great question too. And we didn't start measuring agreement for quite a while, probably only in the last 2 years. What we started to realize is that we were getting a lot of responses on these surveys, large data set of now what we have cleaned 600 networks. The question that has the most variability is one that asks people, how successful has your network been at reaching its goal? And then usually the question will describe what the goal is. That one question has more disagreement than any other question on the survey across all the different questions. So we started thinking about that, and we thought, is this just a terrible question with no reliability? And we think maybe, but more likely what's happening is that what we're starting to realize is that in networks, people don't have the same viewpoint on everything, especially on what's happening with the network. So that question in particular, for example, let's say we ask a network that question, and let's say half the people, when they read that question, they think process, right? They think we are a good network because we come together often, we have great meetings, we really get a lot done, we exchange resources, it's a good functioning network. the other half of the people are saying, we sure are a good network, but we have not moved the dial on child and family outcomes at all. So I'm going to put that we're not successful. So the issue, what's usually happening is that networks, as they get convened, spend a ton of time on mission and who should be at the table and goals even, but very rarely do you have a discussion that says, how are we successful? What is success for us? Is success that we have a good, high-functioning network, or does success mean that we've moved the dial on child and family outcomes? And so from that perspective, we're often trying to assess, through now the nature of that question, the degree to which the group agrees on the answer, because that tells us whether we have to do more work on making sure that we are moving forward with the same mindset, that we're moving forward with the same ideas in mind about what that network should be doing. Because we always say, if you cannot agree on what success is, it's impossible to be successful. So that's just one example.
Great.
So maybe just one more.
Sure. How specific do the desired outcomes need to be? Achieving success seems to be a motivating factor to getting people to show up, yet narrowing in on desired outcomes can be limiting.
I'm not really sure what that question quite means. So in an outcome question, like one of the outcome questions on the partner tool, people ask it in two ways. Either, what outcomes do you think we should be achieving, or what outcomes have we achieved? And usually the respondent will, or the person who puts together the survey will come up with the list of outcomes. So being successful might be motivating, but achieving outcomes is, you know, what we really are there for. So I can see why that's maybe feeling a little more tangible, if maybe that's what you're asking. So I think so in terms of how specific do they need to be, I mean, really all we can measure is process type outcomes. So like, do we have more advocacy? You know, have we increased education? Do we have more coordination among partners? You know, those kinds of things are those kinds of outcomes. I think one of the benefits of asking that in the survey is that what you get is, again, perspective. If you have 50 members of your survey and they're all telling you what they think you know, you've achieved, you get a better sense, because we don't know what's happening. We don't know the backstory of all 50 members, but they know themselves, so we get this chance to see what they all said. And again, then we get a chance to look at agreement and say, all right, do we agree as a network that we are moving towards the same outcomes? So that question was a little harder to answer because I'm not sure I understood it. But so I think we'll have to wrap up with that question. There are a lot of other questions, but I think that we'll have to answer those offline. And just wanted to say thank you, everyone, for joining today. It's always fun for us to get to talk about what we do. We're a super geeky team and like to do this kind of stuff as much as possible. And if anyone has questions for us offline, please feel free to email partnertool@ucdenver.edu. That's the best way to get your questions answered, either about partner or just these things that we're doing. And hopefully we'll see some people at our Network Leadership Training Academy. That's going to be a fun time this year. So look forward, and please join us in April for our next webinar. And thanks so much, everyone, for joining today.